At the Modern Nose Clinic, we intend to prepare you completely for your upcoming in-office procedure. It is our goal for this to be a truly world-class experience. Let me orient you to your preoperative packet. Let's take a look inside. This is a preoperative packet for a nasal stent procedure. On this side, we have our consent form and we have a list of risks. We'll show you that momentarily. Behind that, we have our preoperative instructions on this side, and we have our postoperative instructions on this side. We will also list the date of your procedure, the time that the procedure starts, and the check-in time, which is always 1 hour early. It is important that you get here at least 1 hour early. That will permit you and your caregiver plenty of time to get comfortable. Here we have your consent form. We will be performing repair of nasal vestibular stenosis. This will be strengthening the lateral wall or the outside wall of your nose so it does not collapse so easily. Take your time and read through the consent form, but it's very important that you sign here and you leave this paperwork with us before you leave this appointment. Here we have our list of risks. Take your time, read through this. Once we've answered all your questions, make sure that you sign and leave this paperwork with us. Please consider that there is a certain degree of art when it comes to this procedure. It is important that we can strengthen the lateral nasal wall without leaving any cosmetic change whatsoever. If anything, thus far, those patients who have noticed a difference have found that their nose looks more attractive. There's less collapse along the lateral nasal wall. However, we do not want to make it too stiff. We want to make it just right. It should still flex at least a little bit. But when you're exercising and when you're sleeping, it should not collapse. So the first point here, possibility of dissatisfaction with the results of the operation. This is something that involves art. We want to get it just right. Thus far, we have done a very good job, and we plan to do so for you also. Please note that having an in-office nasal surgery is significantly safer than a traditional surgery in the operating room. You will not have the risk of general anesthesia, where a breathing tube is placed and you are induced in a coma and paralyzed. This will not be necessary. You will be awake and you will be able to ask questions and interact with your surgeon, Dr. Scarata, and answer any questions that I may ask during the surgery in order to ensure that things are as safe as possible. So having an awake in-office surgery is significantly safer than having a traditional surgery asleep in the OR, where you cannot answer any questions during the surgery nor give any feedback. So now we can move on to our preoperative instructions. We really only have 3 steps here for your nasal stent procedure. Step 1 is you're going to do a trial run of your anxiety medication, and you can do it as soon as possible. If you'd like, you can do it this evening. We definitely want to make sure that you've done this at least 5 days before. And this outlines and details exactly how to undertake your trial run of the anxiety medications. We want you to do the trial run at least 5 days before, and ideally even earlier than that. It's just important that you have some time where you could be home with another adult who can observe and you can take your anxiety medications. They will check on you every half an hour to see how you are doing. They can write down on their form how sedated you are on a scale from 1 to 10. 10 is completely awake and 1 is completely asleep. So, for instance, in 30 minutes, you may end up saying that you are somewhat sedated, and perhaps that's an 8 out of 10. You would proceed to write down 8 next to 30 minutes. In 60 minutes, your adult observer would ask, how are you feeling? Perhaps you feel more sedated. Maybe this is, for instance, a 6 out of 10. They would then record 6 on the next line. At 90 minutes, they would ask again. Perhaps at that point, you would be a 3 out of 10. If so, they would indicate that by writing that down on the line. At 120 minutes, you may be a 1 or a 2 out of 10. Completely sedated, but still alert. Why do we do this? It's important that you have confidence that we have an anxiety protocol that will work for you. As we mentioned before, it is important at the Modern Nose Clinic that you experience a world-class experience. The second reason is we're looking for any side effects. If you have a side effect to any of these medications, Undertaking this trial run at least 5 days before your surgery will provide you other opportunities to try a different anxiety protocol. The final reason is timing. This gives you an idea of how quickly the medications work. If the medications work in 2 hours, then make sure you take them at least 2 hours before your scheduled start time for your surgery. You could take them a little earlier if you would like. That's just an example. Step 2, 5 days before your procedure. So we've moved from step 1 to step 2. Specifically, we'd like you to stop any medications that may thin your blood. We have a few examples here, but do so only under the direction of your primary care provider. Number 2, you're required to have a caretaker to watch you, to drive you here to your appointment for your procedure, and to bring you home, and to stay with you for 24 hours after the procedure. It's important that you identify who that will be, write down their name and their contact telephone number. That way we can reach them if we have any questions. We have your information, but we may not have theirs, so we need to have that information. Finally, it's important that you've actually completed your trial run of your home anxiety medications, as outlined here in your prior step 1. Step 3, the day of the procedure. We've completed step 1, we've completed step 2, and here we are on step 3. You will eat a meal for breakfast or for lunch. Make sure you don't take medications on an empty stomach. It need not be a large meal, make it a light meal, and avoid caffeine or any stimulants. 2 hours before the time of the procedure, which is the same thing as 1 hour before you will arrive here, you will take your anxiety medication, and you may take 1 or 2 tabs depending on the results of your trial run of the anxiety medication, and you will take clonidine, which is used to help to accentuate the relaxation and the anxiety protocol. You will get here at least 1 hour before your procedure. Don't arrive late. This will provide you with plenty of time to get relaxed and comfortable. Bring all of your medications that we prescribed at the preoperative appointment. Bring all of your paperwork, including this fluorescent orange folder, and call our office prior to this if you have questions or problems. This is the pre-procedure preparation. We've now completed this information. We're going to move to our post-procedure information now. The beauty of this procedure is that the recovery is very quick. There are a few things to keep in mind. The first evening, you should sleep with your head elevated. You should do this for approximately 3 days to minimize how much swelling will occur. In general, the rest of the instructions involve trying to minimize manipulating your nose. Yes, you will feel that there's something on the inside of the tissue. You may be inclined to rub your nose, wiggle your nose, or touch your nose. Please do not do that. We have carefully outlined a number of activities that you should minimize doing for the first 1 week, 2 weeks, and 3 weeks. Fortunately, the very next day, you can resume driving, normal activity, return to work, and we will follow up with you in 2 weeks. We encourage you to communicate with our office using our office telephone number during office hours as specified in this handout. If there is an urgent or a clarification question that must occur in the evenings or the weekends, Dr. Scarata has provided his personal cell phone. Whenever possible, please try to text message him, but if necessary, you may make a telephone call, as he tries to carry his phone as much as possible. If you have not heard back, then please message him again within 15 minutes or sooner, depending on the urgency of the question. You completed your preoperative appointment, and I hope that's been useful. If you'd like, we can send a copy of this to your cell phone, to your email, or whatnot. Just let us know at the time of the procedure. We're really looking forward to the opportunity to take care of you awake in clinic. We believe this is the way of the future, and we believe you'll have a world-class experience. It's Dr. Douglas Scarata, the medical director at the Modern Nose Clinic, and look forward to seeing you soon. Take care.